This is Voices from the Hub here on CityHeART Radio, and I am Paige Pelonis. Our first morning segment is going to be our Long Beach Gives Spotlight. So I am very excited to be bringing Dr. Mackenzie Martin to the stage, and I'm going to let her introduce herself. So here we go. We're kicking things off.
Good morning, Paige. Thank you so much for having me this morning. It's wonderful to be here. I'm Dr. Mackenzie Martin. I'm the Executive Director and Dental Director for the Children's Dental Health Clinic. We operate 2 locations. Our main clinic is on the campus of Miller Children's and Women's Hospital here in Long Beach, and we do have a satellite clinic on Santa Catalina Island at the Avalon K-12 school there as well. So thank you so much.
Yeah, thanks so much for being here. I didn't realize you guys were on Avalon as well, in Avalon. It's amazing.
Absolutely. Yeah. Gosh, we've been out there for a while. We built in 2015 a standalone kind of bungalow clinic. So if you're an old school Long Beach native like I am, you probably sat in one of those as a classroom at some point. But now it's also a 3-chair dental clinic on the island, and currently the island's only dental office. So really proud of that.
Very cool. I am an old school Long Beach native, but I didn't know. I love that you can always kind of keep learning things about Long Beach. So that's very cool.
Right.
Right. Well, we are here to talk about Long Beach Gives and all the ways that Long Beach can show up for the clinics. So how can we do that? What are we doing for Long Beach Gives with you guys this year?
Absolutely. So this year, our theme is that every child deserves a healthy smile. We've been in existence, gosh, over 90 years now. We started back in 1932 when we noticed the dental inspector for the city of Long Beach saw an extremely high incidence of dental caries or cavities in students in Long Beach that was causing them to miss school. So he kind of started this program in a small trailer. And we continue that effort to this day. Unfortunately, dental caries remain the most prevalent chronic disease in children, which is staggering considering it is preventable. So this year we are working with Long Beach Gives to continue to give healthy smiles. We work 90% of our patient population is on Medi-Cal. We also do sliding fee scales. And I think what's really unique about our clinic is not only do we help care for kids and teens 0 to 21, but we're uniquely set up to make sure that we are a dental home for individuals with dental disabilities or medical complexities as well. So
that's awesome. I love that tagline. Every child deserves a healthy smile or a beautiful smile. Which one is it?
Both, honestly. But healthy smile is what we're going with. But it can be healthy and beautiful at the same time. Absolutely.
Okay, that's great. And what's the overall fundraising goal, the dollar goal for Long Beach Gives?
Fingers crossed, we're looking for 15,000 this year. Really hoping that the city of Long Beach and the wonderful people that live here can help us reach that goal for it.
Yeah. How have you guys done with Long Beach Gives in the past?
We've done pretty well. This is obviously not our first year doing it, but we haven't quite reached that threshold. So we really made a leap this year to kind of see. I'm sure, like most nonprofits out in the area, it's been a rough, several months. A lot of things kind of on the landscape are going to be changing, we think, in the near future. And so we just want to make sure we can continue working for our kids, our patients, as long as we can.
Yeah. That's awesome. Are there any special events and things that you all are doing for Long Beach Gives?
So keep an eye out on our social media. We are on Instagram and Facebook, CDHC_1932. We'll have lots of content up there. Don't really have any in-person events planned at this point, but definitely going to be giving you guys a lot of good content, a lot of features, a lot of good patient stories coming your way for Long Beach Gives this year.
What's one of your favorite stories? Can we get a little teaser?
Sure. So, fun fact, I've been technically employed by the dentist since January of 2024. But I started out as a volunteer for the clinic when I was 12. So I'm going to date myself all the way back until about 2002. And I started volunteering and kind of looking at the difference that the clinic made in kids' lives. But when I came on as a dentist in 2024, I had the opportunity to work with a patient, medically complex, that came in, been to another office, and had been unfortunately kind of strapped down and kind of forced through treatment options. When he came to me, as he walked into the area, to the chair to sit down, he was already crying. He was already shaking, visibly incredibly uncomfortable. So it took about 6 visits, for us to kind of work slowly and kind of reassuringly. And now every time he comes in, he smiles and he hugs me, and I have not seen a tear in his eye since about that first visit. So, it's just incredibly great to see when you're able to take the time and the attention and talk to the kids and work them through what it is that they're going to be experiencing. It doesn't have to be traumatic. I know the dentist is usually people's least favorite place to be. Yeah, but it doesn't always have to be, I think, what you hear oftentimes, a painful and or a scary experience for them. And that's what we're here to kind of showcase.
Yeah. That's a great story. I'm guilty of I am one of those people. It's not my favorite place to go. So that's a
Oh
great
no, you're not an I hate the dentist person, Paige.
well, not anymore. I've just heard a great story about how it's done.
Okay, go ahead.
That's that you were a volunteer when you were 12 at the
I
clinic?
was. I used to pull, again, back in the day before we had like electronic health records and everything on computers. I would pull the big manila charts that everyone would kind of use to write down their notes that we kept the x-rays in. I would get those ready for the week. I would organize supplies in the back. So it's been a great full circle journey. And I've been able to see, over the years, the incredible things that this clinic throughout its, history has been able to accomplish for the residents of Long Beach and South Los Angeles County.
Yeah. And so you've known since you were that age that you wanted to be a part of giving children a healthy smile.
Absolutely, yeah. The executive director who was there at the time, she was a dynamite woman. If anyone was familiar with the clinic back then, her name was Patty Acosta. She's unfortunately since passed away, but she looked at me when I first started volunteering and just looked me straight in the eyes and said, "Mackenzie, you need to be a dentist." And dang, if I didn't listen to her when she said that, work my way through school, dental school. And then I'm proud to say that ever since finishing dental school, I have always worked in a community health setting. It has been my passion ever since I saw it here in this clinic, and it definitely really shaped where my heart was for the patients and for the field.
Wow. How are donor dollars used? What is that investment like?
So most of the donor dollars are helping us to offset the cost of care. Obviously, I alluded to the fact that, we do accept Medi-Cal, Deni-Cal, depending on kind of what realm you're in.
Yep.
And that actually only covers about 55% of the cost of us providing services. Because we provide specialized services that include intravenous or IV sedation, or even care in the operating room of Miller Hospital. So really, a lot of the donor funds are going to that. Unfortunately, our clinic is also starting to get a little bit aged. We've been in our current location since about 2006. So some of those funds are also helping us to start replace and repair some of our dental chairs, which obviously allow us to treat the patients, some of our sterilization equipment, some of our x-ray and our other technology that is vital to make sure that we give our patients the highest quality care.
Gotcha. Okay. Okay. What are some of the things that you would really want for a donor to know? Like if someone's never given to the clinic before, they're scrolling through the Long Beach Gives, there's
Yeah.
hundreds of organizations on the Long Beach Gives page. What's something that someone should know to get them to stop and look at your page?
Right. I think the biggest thing about the clinic that I wish people would know is the history of the people that are here. The majority of my attendings and our dentists that work here either went through a residency training program in this clinic, they did their dental assistant internship here, they volunteered here even. And so I like to tell people there's magic in this building. And it brings people back and it inspires something inside of them to keep going. And it's seeing the difference that we make for the kids, and the smile that we can give them at the end of the day. So If you ever want to come see the clinic too, feel free. I know the dentist, again, may not be your first stop, but we welcome anyone and everyone to stop by and see and experience kind of that magic, that feeling.
Yeah. You're literally making kids smile. I mean, that's
Yeah,
just
I mean, sometimes they scream a little here and there, but we get a lot of smiles, a lot of laughs, a lot of high fives, a lot of great things from them.
that's awesome. Very, very neat. Well, thank you. What else should people know? What's part of the mission, the vision? What are things that to know?
So, I mean, really what we set out to do here is to ensure that the children in this area have access to care regardless of their insurance status and regardless of their ability to pay. So, we are not turning people away if you don't have any type of insurance. We do have sliding fee scales where you can pay as little as 15% of the cost of the care rendered, which if you paid a bill at the dentist recently, you know how high some of those can get if you don't have insurance. So we really pride ourselves on that. We also pride ourselves, and this is something that my predecessor was very into, being the dental home and treating the patients that other offices, other providers can't and won't
Okay.
because of their special needs, because of their medical complexities. We really pride ourselves on kind of being that home. Around 40% of our patients have some kind of physical, intellectual, or developmental disability. And so we really pride ourselves on being a home for them and a safe space for them to receive their care.
Okay. Okay. And I'm sorry if you already said this, but how many patients do you see in a year?
So we have around 5,500 individual patients. Obviously, many of those are coming more than one visit. All of you should be coming at least twice a year. But we generate usually somewhere 15,000 plus encounters or visits. So that's one of our patients that come back for their biannual exam, or obviously the ones that come back for their treatment, their fillings, their crowns, anything of that.
Okay. Okay. That's a lot.
Yeah.
Yeah. Yeah.
We stay very busy. We love it though, makes the days go by fast. It's a lot of fun. We get to meet so many great people, great families. I mean, we have patients, we've been here so long now that we have patients that now their parents were patients and their kids are coming here. And, the whole family and the generational kind of saga of care is starting. And so it makes our hearts feel very full.
Yeah, that's amazing. The generational piece. That's very Long Beach.
It is, absolutely. I feel like, yeah, there's so many unique things about Long Beach, and it definitely how we show up for each other and as a city together, I mean, is really special.
Yeah. Yeah. I mean, that's the Long Beach Gives thing that I think is so special. It's hundreds of nonprofits not competing for dollars, but supporting one another to raise dollars together. So it's a very special thing.
Absolutely.
Yeah.
Absolutely.
What so without Long Beach Gives, you're shooting for $15,000, right? So I guess the other way to look at it would be without Long Beach Gives, without that $15,000, what what would the risk be? Like, what's the urgency? What?
Right. Yeah.
Yeah.
I mean, I guess the risk for that, not having the Long Beach Gives funding is, we are always looking to kind of continue and expand our reach, expand the access, bring more kids that need us in. And of course, without the resources, as chairs break down, as we don't have ways to fix them, that's one less column of patients. That's one, less day that we have to kind of treat somebody in those areas. It's longer wait times for the kids when they come back. So, it's hard, definitely, if it weren't there, for sure.
Okay. Okay. Yeah. The quality of care for sure.
Yeah. Yeah, one thing that, I mean, we try especially not to do is kind of rush or pile on more patients in a day than we know we can provide, the quality of care for. We try and do, as much work as we can and that the patient is, up to and allows, in a visit setting. And so, we look at then having to extend the number of visits, having to do shorter appointments,
Yeah.
and those are all things we don't want to potentially have to compromise on.
Right. Right. Okay. Okay. Well, is your Long Beach Gives page up? Is it ready to go?
Oh, it's ready. If
It's
you
up.
haven't seen it, everyone should go visit. It's very cute. We got some great punny things on there.
Dude,
Um,
I'm gonna pull it up if it's okay,
oh yeah.
and share it.
longbeachgives.org/CDHC.
Okay, I'm gonna find it right now, and then
I
we'll
hope you
share.
get a chuckle out of the graphic that's on it.
Um, I don't know if for some reason it's not coming up, so I don't know if that's on my end or if there's something wrong with the website. But we will find out. There it is. I got it. All right.
Oh, okay, that makes me feel bad.
Like, oh, no. Adding drama. We were just adding drama.
I was like, the suspense. The suspense was killing me.
I've put the link in the comments here so that everybody can visit it.
Do you see
Yeah.
the cute defying cavities? Are we on the right track? The cute little graphic.
I see a smile that's fighting to shine. I see Leo's story.
Oh yes, okay, perfect. Yep,
Yeah.
you're on the right one. We're on the right track.
Everyone deserves a healthy smile with a little tooth with the toothbrush.
Oh yeah.
Cute. Okay. Yeah, it's a great looking page.
Yeah, we're all about a cute
Great
tooth, you know?
post. Yeah.
Yeah, one thing I'll stand by, we have some of the cutest kids around. I tell you, they're so photogenic. They're so happy to kind of get to take a photo with us and do all of that. It's great.
Yep. Yep. Well, then it looks like so I'm hovering over on my screen here. There's a link for your biannual report, which is great. So for folks who do have questions,
Yeah.
kind of all your facts and figures and things, there's lots of great information on your page. That's awesome.
Yeah. Thank you.
Yeah. Fantastic page. All right. I'm going to come back. Well, I hope folks will check out the page ahead of time so that they have all their questions answered. And then when the gives button opens up, they'll just know right where to go.
Yeah. I
So
agree.
the links open up the Thursday before the 18th. You know, it'll run for that whole week.
Yep.
And you're going to have just content pouring out for a whole week. Is that
Oh
the
yeah,
plan?
get ready. Oh, get ready.
Okay.
Spam overload content. Every cute kid, every story you could have ever imagined coming your way in that early giving period for sure.
Amazing. Okay, great. Do you guys have like any, I don't know, challenges that you're putting out there? Are you doing a matching gift, anything like that?
So we are working on some of that right now. We're really trying to get our staff and our dentists and our board
Yeah.
involved this year. We're kind of creating a little internal, I hate to say the word competition, but a little internal kind of excitement that's coming around with it. So definitely keep an eye on what's going to pop up on the page for sure.
Okay, sounds good. Well, what else? Is there anything that we didn't cover that folks need to know?
I don't think
I
so,
love
Paige. I think you did a great job kind of letting me dive in there. And once I start talking about it, it's hard for me to stop sometimes. So I appreciate you letting me roll on through with it.
Yeah, that's great, as it should be. Well, yeah, just best of luck. I mean, Long Beach Gives is a whirlwind, as you know. It's a very
Oh, yes.
it's a very busy season, and I feel like we call it a season, but it's really like it's all year long because it ends in September and we're going into the holidays. So
Oh, yeah.
it's not really a season. It's like a mindset for the whole year.
Yeah.
So it's a busy time, but it's fun. It's really fun, and I feel like it's just a lot of community love and Long Beach. So
Absolutely. It shows why we all love the city that we're in for sure.
yeah, and it's bright orange and yellows and those fun colors, and it's
Right.
exactly. So have so much fun. I hope it goes well. I hope you guys get to hit that 15,000. That would be amazing. And what a great story that would be.
Wonderful. Yeah.
Yeah,
Thank you, Paige. I appreciate it.
absolutely. Thank you so much. It was great to get to speak with you and just to hear a little bit about your story too.
Yeah.
Clinic since you were 12. That's amazing.
Yeah. Wonderful
Great.
first full circle moments for sure.
It's a beautiful story. It's a Long Beach story for sure.
It is. Yeah.
Awesome. Well, you have a fantastic rest of your Tuesday. Thank you so much for joining us, and go Long Beach Gives.
Thanks, you too, Paige. Have a great one.